Adult Mental Health Research. 30 years of research and innovation working towards better outcomes. There is a strong tradition of research within St. John of God Hospital and Clonmara Mental Health Services of sponsoring and supporting the research development of clinical psychology students, psychiatric registrars on rotation, and occupational therapy and nursing students. The hospital is connected to UCD and the RCSI through its pharmacy, psychiatry, psychology, and nursing departments, where students, as part of their professional development, engage in research projects. Over the years, mental health services have responded to the requests of service users to be involved in research. Projects supporting service users and family engagement have been conducted. For example, research exploring service user views of mental health research. 2 service user representatives of the Source Committee achieved PhDs in a collaborative project undertaken in our services exploring the experiences of inpatients and their family members of inpatient admission. The Research Study Day has been a seminal event for staff and students to present their research since the early 1980s with prize-giving awards. National funding awarded supported staff to attend and present at mental health national and international research conferences. In St. John of God Hospital, 2 important projects funded by the Order of St. John of God were the Eating Disorders Recovery Program, which was evaluated for the CBT program in 2003. The second evaluation was of the Wellness Recovery Approach Program, an approach to mental health recovery, providing a systematic, planned strategy which assists people in recovery and maintaining wellness. Further, the addiction team in the hospital assessed service users' views of stigma and alcohol dependence. A recent St. John of God Hospital article explored the impact of COVID-19 on addiction services and patients. Adult mental health services have published other important work, including recently a paper from Clonmara on COVID-19. The DETECT research program incorporates the longitudinal FEP study, which is ongoing after 20 years. Many conferences have been hosted by St. John of God Hospital, such as the Psychosis Improving Outcome 2009 conference, which brought together national and international researchers. Likewise, an international conference on cannabis and psychosis in 2013, funded by the Éireann O'Callaghan Award, identified barriers and solutions to carrying out complex psychosis research. The training of researchers in Malawi was an important milestone in their academic and research service development. Collaborations with Stanley Medical Research Institute and St. John of God Order funded projects has resulted in many studies and publications. The Liaison Psychiatry Service was an important innovation. Also, the Tele-Psychiatry Project of 2011, the GASS for clozapine, development and validation of a side effect scale, and St. John of God Services implemented and evaluated family group psychoeducation for family members of people with psychosis. More recently, research has centered on the physical and mental aspects together, most notably in the research conducted on patients with severe mental illness and metabolic syndrome called the Health Track Program and the Healthy Activity Program. In all, there have been over 250 peer-reviewed articles, theses, and editorials emanating from studies. For over 30 years, St. John of God Research has been multidisciplinary, innovative, translational in improving outcomes for persons with mental health difficulties. Thank you for listening.
Good morning, everyone. My name is Dolores Keating, and I'm delighted to be able to share our story regarding practice-based research in medicines optimization at St. John of God Hospital. So perhaps we need to start with why. Medicines are a frequently used and key intervention in mental health. While medicines may be only one tool a person might use in their recovery, the experience of using medicines is an important factor in improving outcomes. Research on this topic can help us improve our approach to medicines optimization for mental and physical health, ensure we monitor the impact of medication use, and help us find ways of facilitating engagement and minimizing risks. The pharmacy strategic approach to research has been influenced by the principles of medicines optimization. So medicines optimization is about ensuring the right person gets the right choice of medicines at the right time. By focusing on the service user and their experiences, the goal is to help them to improve their outcomes, actively use their medicines in a beneficial way, avoid taking unnecessary medicines, and improve medication safety. So, inspired by the organizational culture of research and teaching, in 2014 I approached the Royal College of Surgeons in Ireland and pitched an idea. Wouldn't it be wonderful if we could work together, align the vision and mission of both organizations to deliver education and research that would ultimately improve the provision of services for people experiencing mental health difficulties? The Memorandum of Understanding incorporated the core principles of recovery, medicines optimization, and activation. Our hope was that this collaboration would move beyond the provision of clinical placements and academic appointments to using research to ensure the pharmacy profession could contribute to its full potential in mental health care. Now, our small group in the pharmacy had the support of management level, the expertise of experienced researchers and mentors within the organization, and a whole team of new colleagues in the university to drive our research strategy forward. So to give some examples of research outputs and achievements so far, Caroline Hines published our first paper in schizophrenia research in 2015, describing development and validation of a self-report side effect scale for clozapine. She then went on to describe how this tool can be used in clinical practice and how it benefits our service users. Her work has been recommended for use by the British Association for Psychopharmacology, and it is also recommended in the American Psychiatric Association guidelines for the treatment of schizophrenia, published in September this year. Early engagement with the national clinical programs led to a project reviewing the quality and utility of clinical guidelines for the pharmacological treatment of first episode schizophrenia. And this has given us the opportunity to be involved in a number of projects related to medication use. Audrey Purcell's work on VTE prophylaxis allowed us to advocate for the consideration of acute mental health in the National Quality Improvement Programme. We know that there are significant health inequalities for people experiencing severe mental health problems with multimorbidity and often unaddressed physical health needs. Through the OPT-SMI study, Aoife Carolyn aims to use prescribing indicators to help us ensure physical health needs are met. One of the key aims of the collaboration with RCSI was to create significant learning experiences that would build on the foundation knowledge provided in the university. we could integrate that knowledge in clinical practice and support the caring and human dimensions of learning. And so we embarked on a program of educational reform. Service users and caregivers advised us on how the curriculum could be improved. Our ideas and approach to patient and public participation in education were incorporated in the RCSI strategic plan. A pragmatic approach to actual site visits that could address some gaps in the curriculum was needed. We created an intervention accessible to us that would help them the patient journey through the mental health services, demonstrate the value of multidisciplinary working, and hope to dispel some of the myths associated with the inpatient setting. We've conducted longitudinal evaluation of the programme over 6 years. Mental Health First Aid Ireland training and research programme began with the research question: how might we improve the pharmacy graduates' age in mental health care? A systematic review of Irish mental health research and policy informed the adaptation of the Mental Health Aid Manual and materials for Ireland. The very first course was delivered to pharmacy students. Donal Scanlon and the team have gone to train in excess of 8,000 people with over 50 instructors nationally and engage with independent research for programme evaluation. But every year we return to where it began. Mental health first aid is now included as a mandatory of the undergraduate pharmacy in RCSI, in the same way as physical health first aid is. And on the advice of our service users, the programme is delivered within a physical health module to support the integration of mental health throughout the curriculum. As a project pipeline, the immediate future looks productive, with a number of papers at the later stages of completion. We're coming to the end of our first phase of research strategy and hope to visit our programme early next year. It's been a busy, challenging and rewarding few years. I appreciate the commitment of the pharmacy team and I'm grateful to all those who helped us. The culture and tradition of the organisation in using care to inform and implement in care gives us the why to drive our research programme forward. Thank you.
I'm here talking to you today about psychological research in SJOG Hospital. And it has a long and interesting history that I only really discovered as I dug into it over the last couple of weeks. My name is Keith Gaynor. Some of you may know me. I've been a psychologist in SJOG Hospital for the last 8 years. And it's been, I suppose, one of the key themes that emerged from this research into the hospital was the importance of collaboration and collegiality. That there's been a huge amount of research that's gone on, and a key part of that has been psychology department collaborating with other departments, collaborating with other groups, and working with a diverse range of approaches and a diverse range of client populations. Some of you might recognize some of these faces from the past. Ali Darcy, who would have done research here in the 2000s, went on to work in Stanford and develop WOBOT, a mental health app. Gary Donoghue, who worked in SJOG Hospital in the 2000s as well, and now Professor of Psychology in NUIG. Catherine Dugan, who works in the Institute of Neuroscience in University College London as a senior researcher now. A wide variety of people who developed long and very successful research careers, and they started out in SJOG Hospital. When we look at the diversity of approaches and people who worked on it, we can see papers in psychosis, depression, emotional dysregulation, in first episode psychosis and in long-term schizophrenia. We can see work in a range of different therapeutic approaches. And there's just, I suppose, a very broad, open-minded approach to how research has been done. And I think that's to the hospital's credit. We look at just some of the papers that have been published. We see papers in psychosis and schizophrenia, which of course St. John of God's has a long tradition of. We also see papers for alcohol and substance use, which again the hospital will be well known for. And we see papers in CBT and with emotional dysregulation and in anger. And the hospital has produced a high range of very successful, high-impact papers over the years. It's also been the starting ground for a long number of theses, research theses, and practical theses. And this is based on the collaboration between St. John of God Hospital and universities across Ireland. And so, although St. John of God Hospital is known as a teaching hospital, within that teaching, there has been thesis upon thesis and research upon research. And those are just a few of the people may honestly know: Zita, Admiral Quirk, Leonie Keogh, Catherine Dugan, Ali Darcy, who all would have done their theses in the 1990s and 2000s. The current research again shows a diversity of approaches and a diversity of outcomes. There's current research going on in DBT, looking at the importance of group processes. There's work on compassion-focused therapy and the effectiveness of group compassion-focused therapy. There's work looking at stigma and addiction, coping with COVID-19, and building social connections in those with enduring mental health difficulties. And I suppose with these as the groundwork and the collaboration between departments and ongoing connection with universities across the country, it feels like the research approach in St. John of God within the psychology department, St. John of God Hospital, is going to be very rich. And among many of my colleagues, I've always felt lucky for the value of the collaboration and collegiality between the psychology department and all the other departments in St. John of God's.
Okay, thanks very much, everybody, and delighted to be here and hope you're enjoying the conference so far. My name is Colin O'Gara. I'm a consultant psychiatrist here at St. John of God Hospital and also clinical professor at UCD. And I'm delighted to speak to you today about addiction service research and the work that we've been doing here at the hospital in addiction. So we are a very busy addiction service, and we focus on addictions to a whole host of issues. We divide, you can divide our work into detox in the first instance and rehab. They're the two main facets of work that we do, and by far and away the most common issue that we deal with is alcohol. And we also deal with a range of drug problems as well, and stimulants, opioids, cannabis, and benzodiazepines in particular in the sedative group. As a psychiatric hospital, we also deal with regularly psychiatric comorbidity, meaning mental health problems. And critically, our research is clinical. It falls into the topic of clinical research, meaning that we're all very busy clinicians who have significant caseloads, teaching duties. We regularly have medical students and full multidisciplinary teams and colleagues that work with us. You know, our team members, apart from being expert in the clinical side of things, they're also research active and work with a whole host of collaborators nationally and in some cases internationally. So very lucky to have excellent colleagues in that regard. In more recent years, we have focused on process addictions. Prior to that, we've done research in, you know, pretty much all the different areas, including alcohol, drugs, and nicotine. Nicotine was the focus of my PhD. We've gone back over 10 years now to completion of that work. But in recent years, it's definitely process addictions is what we've been focusing on. And what that means is substance addiction and non-substance addictions where there isn't particularly a substance involved. And the type of processes we're talking about are gambling, video gaming, known as internet gaming, sex, food, exercise, and there's probably a lot more rarer forms of process addictions also that we come across as well. Most common by far is gambling, and gambling is a big problem in Ireland at the moment. Gambling addiction in particular, a gambling disorder as it's known. We've been active in highlighting the deficits with regard to gambling, service provision, research provision, and regulation over the past few years. And this is an editorial published in 2017, which highlights basically that, you know, legislation needs to be enacted for the protection of players across a whole host of gambling products. Unfortunately, we haven't had any luck with that, and it's not looking great at the moment either, although there's some, you know, as per usual, there's some commentary that it will get better, but at the moment it's not looking great. We wanted to get an idea of prevalence, and in doing that, we set out in probably 2012 onwards to do a national survey. We found it difficult to, you know, get our survey out there amongst a whole host of other surveys. We ended up with 200 people in that survey. We had certainly had designs in it being far bigger, but it was certainly a start, and it showed what we thought we would find, which was that sports betting and mobile device usage was the most common, with a lot of people in the sample, 75% of the people borrowing or stealing money to fund their gambling, which was even harder than we thought. And a good chunk of people in the population study felt that the harms of gambling should be advertised. Over the past few years, the service has been very keen to highlight deficits in responsible gambling initiatives in the country, and it's also a problem internationally, but particularly in Ireland. We're talking about real-time feedback, age verification, and limits on betting times, and the amount of betting spend limits as well. So we studied that with Keith Gaynor, who was our lead author in that paper, and that demonstrated significant deficiencies, as we expected, in responsible gambling tools and initiatives within the country. Service provision is the next area we wanted to look at, which, you know, in essence, we thought that we would find very little of it. For many years, it's been proposed that an Office for Gambling Control would be initiated, of which would be funded. It would be funded by a social fund, which would come from a betting levy or an overall fraction of the overall turnover from the gambling operators. And unfortunately, that hasn't come forward yet. So the current service provision with regards to gambling is currently very poor in the country. There's a David Collin paper with Mark Griffiths, and we did that through Freedom of Information requests, and got a lot of buy-in into that study, and a lot of services and community health organizations and local drug task forces responding and helping us get the data together for that. Advertising, is a huge problem in Ireland with regards to the overexposure of gambling ads, not only to adults but also children. In essence, there are too many ads and too often, and these ads do influence behavior and ultimately the development of gambling disorder. And the advertising, the harms of gambling are too limited in Ireland also. Again, this is a study that David Colin, as part of his MD thesis, led with a number of other clinicians that were working in the service at the time. And this looked at advertisements in various sports in Ireland and essentially demonstrated that the rate of these ads is, as expected, high and is something that needs to be controlled. We have also focused on internet gaming disorder, which is a relatively newly recognized problem. There is an increasing sophistication of games and increasing sophistication of devices, hardware. This is basically leading to an addictive product. Of course, it's a controversial topic. Some believe that it is not addictive, that it is just overclassification, there's psychiatric disorder that is basically unnecessary. But we're beginning to see more and more referrals for internet use disorder, which is just generally the overuse of the internet, and also internet gaming disorder. We have highlighted this in, again, an editorial last year, highlighting the harms that are prevalent with gaming disorder, and then followed that up with a survey of gaming problems within Ireland, which showed that the prevalence is probably similar to international data as well. So with regards to the future, we have ongoing studies going in most of the areas: alcohol, gambling, gaming, inpatient rehab. So there's plenty of scope there, and if anybody's interested in doing work with us from a clinical point of view, if you're a clinician or otherwise, we'd be delighted to hear from you. So thanks very much for listening, and the best of luck with the rest of the conference. Hope you enjoy it. Thanks very much.